Afternoon, everybody. My name is Dr. Eric Dillon. I am the Director of Admissions and Enrollment for the College of Nursing. We'd like to thank you for taking some time to participate in our webinar regarding our DNP program for nurse anesthesiology or nurse anesthetist, if you would. I will have Dr. Nate Apatow introduce himself real quick.
Hi, I'm Dr. Nathaniel Apatow. I'm the founding program director of the Roseman University College of Nursing, doctorate in nursing practice, nurse anesthesiology. That's a mouthful.
And then we also have our Director of Financial Aid, Ms. Sally Michelson.
Hi, welcome everybody. I'm the Director of Financial Aid. I'm Sally Michelson, and I'm going to talk a little bit about money because that is almost always everybody's concern.
All right. And at this time, I'm going to switch it over to Dr. Apatow to start the presentation.
Okay, now people chime in while I'm speaking?
That is correct. So I will be managing the chat just as an FYI. So if any of you all have questions, you're more than welcome to post in the chat. Towards the end, we will have additional Q&A. But if you do have questions along the way, just by all means type in the chat and I will do my best to answer them as they come up.
Okay, very well. Then welcome all y'all. I'm from New York City, so that makes perfect sense. All y'all to Roseman University. And here's a picture of some of our players. To the far left is our dean, Dr. Brian Oxhorn. The gentleman on the top is John McDonough. He was helpful in getting the program started. The devilishly handsome gentleman in the middle is myself, and Dr. Brad Stelflug, the associate program director, is on the bottom right. Dr. Stelflug is in attendance, I think, somewhere in webinar ozone. So just to get to basics, what is a nurse anesthesiologist? We've changed our name from nurse anesthetist to nurse anesthesiologist within the last couple of years. Nurse anesthesiologists work delivering anesthesia to patients all around the United States. They can either work in a team with a physician anesthesiologist or solo. Nurse anesthetists provide general anesthetics, epidural anesthetics, spinal anesthetics, peripheral nerve blocks, pain management, and a whole host of other medical procedures which is within our scope of practice. Interestingly, the first anesthetists were nurse anesthetists. Back in the 1800s, nurse anesthetists provided anesthesia during during the Civil War, World War I, World War II. Notable nurse anesthetists include Alice McGaw and Agatha Hodgins and Sister Mary Bernard. We have a long, proud history of providing anesthesia care to patients. Currently, there are about 60,000 CRNAs in the United States. There are about 140-ish nurse anesthesia programs in the United States. In the state of Nevada, there's only one nurse anesthesia program, and that's ours. Our program at Roseman University was recently accredited by the Council on Accreditation of Nurse Anesthesia Programs, and we're currently, again, the only accredited program in the state of Nevada. CRNAs provide anesthesia services in cities all across the country, and in rural areas, CRNAs provide more than 80% of anesthesia, primarily in places where physician anesthesiologists either aren't interested in providing them or don't want to move there, etc. There's a lot of politics in anesthesia. Interestingly, 22 states and the Guam have opted out of the federal requirement for supervision by a physician. Unlike other anesthesia providers, nurse anesthetists can operate in every state, in rural areas, suburbs, cities, in all across Nevada. We provide anesthesia services in hospitals, clinics, podiatry offices, dental clinics, etc. We provide anesthesia on OB units and endoscopy centers. We're providing a lot of anesthesia all around the country in every possible scenario. Roseman University will never guarantee a job for you folks, but frankly, the job market is wide open. The job market for nurse anesthetists is crazy right now. So although we will never guarantee you a job, everyone is probably going to get a job. And I've been a program director prior to Roseman. I was program director in Virginia, and our students had multiple offers before they graduated their program. So the outlook for jobs is great. We're no longer going to be paid in Bitcoin, so you're be very happy. And if you go on a mission trip, you can get paid with goats or chickens or whatever you like. That's a joke, Dr. Dillon. So please, a little bit of a smile. I adopted that slide from my colleague. I thought it was funny. Okay. So how do you become a nurse anesthetist, a nurse anesthesiologist? First, you have to have a bachelor's degree in nursing or another related field. So if you are a registered nurse and have a bachelor's in in that's not in nursing, but you are a registered nurse and can be licensed in the state of Nevada, you're eligible. You need an undergraduate grade point average of at least 3 years of a 3.0 minimum, and you need at least 1 year ICU experience. The 1 year ICU experience is not waiverable. It's a national accreditation requirement. And of course, you have to apply to Roseman University. Our program, which we're going to start seating students in July of this year, July 8th, we're going to start our first class, uses Roseman's 6-point master learning model, which I'll go into a little bit right now. It's very different from any other nurse anesthesia program in the country. We use a block curriculum versus a semester or trimester system so that students are able to focus on one class at a time. So you take a class, you demonstrate mastery, and then you go on to the next class. That's how Roseman's model works. It's worked fabulously for the School of Pharmacy. It's worked fabulously for the School of Dentistry, and now it's going to work fabulously to us. So it's really a great system where instead of juggling 3 or 4 classes at one time, you have one class, and you're in that class until you master the material. One of the points in Roseman's 6-point mastery learning model is that rather than lecture for hours upon hours, what we're going to do is use lecture for a short period of time and then break up the day with using discussions, case presentations, simulations. We're going to mix it up to help facilitate adult learning and adult education. It's not going to be the typical sit in a seat, listen to somebody drone on for 3 or 4 hours, and then go home and try to figure out what they said. Roseman's model uses a competency-based system so that the only way you get finished with a class is if you're able to show that you've mastered the class, meaning you've achieved a score of 90% to pass every class. 90% is passing. For every class, you must achieve competency. The system that we're using is based on learning, assessment, feedback, and then another reassessment. So if you're not able to master the material the first go around, that's okay. We go back to the drawing board, figure out what the student is not able to master, and we'll work with each individual student and then reassess them. And theoretically, the second time around, you'll be able to master the material. Important in this model is that you have early exposure to clinical. So after probably 1 year of enrollment, the first 6 months is going to be a lot of the DNP classes that are not necessarily anesthesia related. The next 6 months are going to be anesthesia classes. We need you to have a little bit of information before going into clinical. And at that point, you'll start clinical. You'll start clinical where you'll be in clinical a couple of days a week, probably just taking in the environment, not being responsible for doing anything other than learning. You won't be responsible for taking care of patients. You'll be responsible for putting one and one together and figuring out what it means to be a nurse anesthesiologist. Unlike other classrooms, Roseman's classrooms are set up to form a circle so that the professor's in the center. I'll show you a picture. And what the reason for that is so that you feel that applicants and students feel like they are in touch with the faculty and they can reach out and get individualized instruction at any particular time when we're having a discussion, a lecture, what's the word? Any simulation, and any of our activities to help you learn. So that's how that's Roseman's model. Instructor in the center, the students around, so that we can all communicate. So one of the things that makes the difference between a good anesthesia program and an excellent anesthesia program is their use of simulation. And we're going to use simulation quite a bit more than other programs, I believe. Um, we're in the process of building a simulation center. We're also in the process of buying several different innovative simulation tools to help students find their way in education. Back in the day, we used to practice epidurals on using an epidural needle on an orange, but that's very different from today. We have simulated backs, where you place a needle and you get simulated cerebrospinal fluid. It's all the technology is all very cool. We may use a VR simulator to help. We're in the process of purchasing several of these really very new innovative tools to help us educate students. We have a high fidelity mannequin now. Back in the day, you'd have to practice on a classmate or a patient for the first time you're performing intubation. That's not the case now. We have a high fidelity SimMan 3G. The SimMan can talk, breathes, coughs, tongue swells, has pulses, has breath sounds, and it's pretty impressive technology, and it helps students learn their rudimentary skills prior to going into the OR and working with real patients. While the academic portion, the didactic portion is extremely important, the clinical piece is equally important. We've partnered with a number of hospitals in the area, and at this particular time, we'll be sending students to Sunrise, Summerlin, Mountain View, Valley Hospital, Centennial Hills, and Henderson. We also have a site in Riverside, California, and we're in the process of getting 2 or 3 other Dignity Health hospitals in the greater Henderson, Las Vegas area. The degree which we will be offering will be a DNP in nurse anesthesiology. It's been a couple of years since the profession has stopped awarding master's degrees in nurse anesthesiology. So the only way to become a nurse anesthetist or nurse anesthesiologist is to have a doctoral degree. One of the important parts of the doctoral degree is the DNP project. Some people will call it a capstone project. Some people will refer to it as a scholarly project, but we will walk you through the DNP capstone project, which we're hoping that you will finish at least 6 months in advance before the 3-year program is over, so that you can have time to finalize your case numbers and prepare to take the national certification exam in nurse anesthesiology. So the question becomes, what are we looking for in applicants? And the answer is, you've got to be smart, and you've got to be highly motivated, because there's just too much work. Not only do we have to help you learn the DNP nursing part, which is health informatics and public policy, etc. But the most important part are the anesthesia pieces, the raw science that goes into how to be a nurse anesthesiologist. So we need you to be super smart, highly motivated, confident, flexible, both in the classroom and in the operating room. We need you to be able to keep your composure in emergency situations. And in the operating room, there are plenty of emergency situations. More practically, we need you to be financially prepared in order to take on this 3 years of going to school, because you cannot work while you're in the program. There's just no time for you to work. And you need to be big boys and girls, big adults, emotionally ready, and be prepared for adult learning. Most of the didactic is going to occur on the Henderson campus. We're going to use a combination of hybrid education, meaning some of it'll be online and some of it'll be butts and seats in the classroom in Henderson. At some point, we'll move simulation, I think, to the Summerlin campus, but that's not going to happen for at least 2 or 3 years. But initially, it'll be a combination of online courses and brick and mortar school in Henderson. That's the long and short of it, and I think we're all ready to take questions if you have any. Dr. Dillon?
All right, Nate, we have a lot of questions coming through, but some of them I am answering in the chat, but there are some other ones that came up that I think will be specific to you.
Okay.
So one question came up, are students ever responsible for finding their own clinical sites?
The answer to that is no. I know there are programs that ask students to find clinical sites. That's not us. It's too difficult. In a lot of the FNP programs, there are no choice. There's no choice. They have to do that. But in our program at Roseman, students will not be required to find their own clinical sites. We will we will find all the experiences you need.
Okay. Will your program be included with the U.S. military's HPSP scholarship program? Either Army, Navy, or Air Force. That's the Health Professional Scholarship Program.
Yeah, so that's an interesting question. That has nothing to do with us really. HPSP is run by the military. Although we're currently in negotiations with the United States Army, hopefully to take their overflow students. I think because we are an accredited program, there's no reason why, as an HPSP student, you couldn't go to our program. I was former program director of the U.S. Army's graduate program in nursing and nurse anesthesia back in the day. So I've got a pretty good relationship with the military, and that's something we should be able to figure out.
Sally, do you have any comments? Yeah.
Yeah, I echo what he said, because I suspect once we get on their radar, we'll be eligible. Just as an aside, we have about 20 students every year in the various branches of the military's HPSP program, mostly in our College of Dental Medicine and our DMD degree. But we do have other VA programs, but that's a great question.
Okay. One of the other questions came up was the graduated from a pass, no pass program similar to Roseman. So I'll speak a little bit to that. One of the things that we'll be doing is reviewing all transcripts, transcripts regarding your academic program. We'll be looking at how those grading scales are set up as well. For example, if you went to Roseman, then you know that everything here is at a 90%. So we know how to convert that. So those will be on case-by-case basis in a sense, because we have to see what their proficiency levels are for each one of the institutions. So it's not a no answer, if you would, but it will be on a case-by-case basis as far as how that pans out, if that makes sense. but it does not make you necessarily less competitive, if you would. Will the simulation center be completed by the start of the first cohort?
So that's a great question. So we're going to be working with the College of Medicine to get to establish simulation center, but we have to have something in the interim. So we're going to build something at on the Henderson campus in the interim, so that we don't have to wait for the College of Medicine.
Okay. You guys got a lot of questions. I love it. So if I'm in a Master's of Nursing program, will any of my master's program classes cross over? Are you talking, I guess, to clarify that, are you referring to master's courses crossing over into our DNP curriculum, or are you talking about it from a perspective of admissions? I think that's where I might be a little unclear there. So if you want to type that in, that'd be great. But I'm going to go on to the next question. Next question related to specific science courses for the science GPA.
So the question is, which science courses?
Yeah, what specific science courses make up the science GPA?
Biology courses, chemistry courses, physics courses, and college level math courses will fall into the science GPA. I can't name each individual course because different universities have different names, but essentially biology, chemistry, physics, and higher level math courses.
All right. I'm trying to scroll back up so I can get there. So are there any time limits on the science courses?
Science courses have to be within 10 years. Otherwise, science has changed so much, you'd really be one would really be at a disadvantage. So I think science courses older than 10 years you probably should retake if you haven't already, because things change so rapidly.
I know we kind of spoke about this, but another question was, do you have the option to choose from the list of clinical sites, or will that be assigned accordingly?
No, we're gonna assign clinical sites. Students picking their own clinical sites doesn't always work out for a couple of reasons. One, there's a limit on the number of students that can be taken care of at each clinical site. Certain clinical sites are better for new students who are starting out, meaning faculty are prepared to work with students and see more patient, and there's not such a push for production or OR turnover. So it's always best when we pick the clinical sites for students. We will assign students to particular clinical sites.
Okay. Will the didactic portion be online?
As I mentioned,
Yeah.
I'm sorry, it's a hybrid program. Some of the didactic will be online, but largely the science courses, the anesthesia, all of the anesthesia content, and most of the science courses will be in person on the Henderson campus.
Perfect. Just as an FYI, the application deadline is set for June 1st. Let me just remind you all, do not wait until June 1st to submit your application. Although we are not on a rolling admissions, we are anticipating and already have received quite a bit of applicants that are going to be reviewed. So do not hesitate in turning in your stuff because those who wait to the last minute, it's just not a good look ever. So just throwing that out there. Sally, you looks like you may have a question or a comment.
Yep. Two things. I just saw another one related to the question about hybrids and versus in person. And someone said, do you have to move to Nevada at the very beginning of year one, or can you wait until year two?
After the first 6 months, you'll need to move to Nevada. Approximately 6 months, because we need to see you and you need to see us. Roseman's model works best when students collaborate on their education.
Next question. Do you have to have the minimum 1 year ICU experience by the time you start the program? I believe you want that beforehand, correct? At the time of application,
Well, so
right? Or no?
there's a deadline that there's a mandatory 1 year. So if an applicant had exactly 1 year in July, on July 8th of 2024, in theory, they would be eligible to be seated. The fact is, you'd have to have a pretty impressive um, application packet for us to take you with a bare minimum of 1 year. I've done it. I've accepted exceptional students with 1 year of experience, but you'd have to be an exceptional student.
Okay. Sally,
Did you
you
see
have,
did you see the question about what kind of ICU? SICU, CT ICU, MICU? Do
I,
you prioritize
I'm working
preference?
on going down
Oh,
the line.
I just saw it because it was in that, so I'm kind of reading too. So if it's in the vein of what he's answering, I thought I'd just
Actually,
pop in.
Sally, can you
Sorry.
do me a favor? Are you looking at the Q&A chat or the main chat?
Both. I'm kind
I
of
was gonna
looking
say,
at them
do
both.
you want to just go back and forth? You maybe manage the Q&A chat and I'll do the main chat.
Sure.
All right. So in the main chat, the next question I see is how much time will be spent on learning blocks?
Each block will be between 3 and 5 weeks. So if typically, but not always, a 3 week course would typically be a 3 credit course would typically be 3 weeks long. But for some of the content, like some of the anesthesia content, we've added an extra week just because some of the material may take a little bit longer to grasp.
Sally, I'll let you go with the next question.
So Eric, I don't know if, or Dr. Dillon, sorry, I don't know if you answered the question where the master's program, and then they responded admission. So I don't know if you
Yes.
have an
So
answer.
with that particular situation, yes, we will be looking at all transcripts. So if you do have a master's degree, we will look at that as a part of your overall admissions packet, if you would, for review.
Want me to go again?
Yeah, I'll let you go again.
Is the CCRN still a requirement? Any other certifications required or preferred?
We're requiring the CCRN, yes, and the GRE is at this point is we'd like you to have it, but it's optional.
Okay. How recent does the ICU experience have to be?
Recent, meaning you should be working in an ICU as you apply. So certainly within the last year.
So how much does the program expect students to travel to distant clinical sites? Like how far, basically, I think is what what they're asking.
Well, most of the clinical sites are in Henderson and Las Vegas. The one clinical site that's in California at this point, the one clinical site that's in California, um, we probably will not require students unless they're interested in going to California, unless there's an exceptional experience that they weren't able to get in Henderson and Las Vegas. Then in that scenario, we would send them to California. But I suspect, again, early on we haven't sent any students anywhere yet. It's likely to be optional whether you get sent to California.
All right, so when can we expect interviews to be conducted? We're currently reviewing all submitted applicants right now. We hope to have them hopefully in the next week or so that we'll probably start. Is that correct, Dr. Akpaton? Maybe?
Yep, next week we're going to sit down and go through the completed applications.
Okay.
One other question, will the higher level science courses be weighted higher in the GPA calculation or the overview?
It's going to be all encompassing. So basically, we're looking at all of the ones that we would accept essentially. So, and then it's going to be cumulative from that point, if that makes sense. So there's no weighted ranking on, let's say, a 1 versus a 300 level. But it would be only those that are the ones that we are going to accept, if you will, or that we would require. So most of you may have taken anatomy and physiology in your, freshman, sophomore year, but if you've taken something in your junior year that was, more advanced, that's still all going to be together. okay? But like a random plant biology type course is not going to be a part of it, if that makes sense. Is that a fair assessment for you, Dr. Apatow?
Sure.
Perfect.
And different universities number their courses differently. It would be
Yes.
impossible to weight those. I mean, it's just not possible.
Yeah. So again, we're not on a rolling basis. However, we are in the process of reviewing applicants so that we can prepare for interviews. So be on the lookout for that. If you have your application submitted, if you haven't done anything, you need to make sure that you get in there. Also, keep in mind that Portia Braxton is the admission specialist for the DNP program, and I will be assisting her as well. So if you have questions surrounding the admissions, you can reach out to either one of us and we will assist you accordingly to move you along through the process. And then if there are things that are missing, that's what we're going to be following up with you about, such as letters of recommendation or missing essays or personal statements, any of those things, we're going to be working with you to ensure that you have all of that stuff. So if you haven't done any of that stuff, try to get that in sooner rather than later, because that will hold up whether or not you'll get an interview if you would. So, Sally.
More science classes. You mentioned the 10-year. Is that a hard stop? Since several people are saying I graduated more than 10 years ago, is that a requirement that they have to be within 10 years?
It's not a hard stop, but an applicant would be less competitive if their sciences are old.
So one of the things, like another person asked, because they just completed a doctorate of pharmacy, even though their sciences are more than 10 years old, does the PharmD, would that help that application?
It would help that application. Again, there are going to be certain applicants who fall outside of the recommended criteria, and we are going to use a holistic view of applications so that if you're an exceptional applicant, but your sciences are old and everything else is super, you may be asked for an interview. So again, if you think that you're interested, I would apply. If you have a doctoral degree and you have a doctorate in pharmacy, DPH, for example, I think that makes you a pretty good applicant, even if you have old sciences.
Mhm. So how many applicants are we going to accept in the first cohort? Our max, are we going with the max of 20? Is that correct?
20 is, at this point, 20 is the number that we've been approved by the accrediting body. So if we had 50 superb applicants, I would ask the accrediting body for more seats, but at this time, I think 20 is the right number.
So,
Interviews in person or virtual?
Well, here's the issue with that. We're seating students in July, and this is already March. So we're going to play that by ear. If the applicant is local, I think we'll call that person in for an in-person interview. If the applicant is distant, and it's a hardship for them to come for an in-person interview, we'd probably do that via Zoom or some other um, virtual platform.
yeah. So with the GRE, it's one of the requirements. What standards of score do you guys seek for? Is there a score we need to reach?
It's not a requirement. It's optional. For this year, it's optional, and we're looking for about 150 on the two sections, so a 300 combined.
Dr. Dillon, I think you mentioned this, but I can't remember where. Besides the nurse CAS application, they have to do the Roseman supplemental application, correct, to be considered
That
finished?
is correct. Yep, you have to
Okay.
do the Roseman supplemental application that is embedded in the CAS application when you do that. There are other aspects that are part of that application that tells you need to submit your scores, your license, your certifications, your personal statement. All of that is going to be outlined on the branding page of the CAS application. So And then again, when you do that, if there are documents that are missing, more than likely you're going to receive an email or a phone call communication from Portia, who will let you know, hey, these are the docs that are missing. Someone had a question about, are interviews going to be clinically based questions or more EQ questions?
It'll be both.
More application questions. Do you have to have shadowed a CRNA prior to applying? What's the number of hours?
We don't have a requirement, but if you're smart, you'll have shadowed a CRNA. In the event you're offered an interview and you're asked, what does a CRNA do? Have you spent any time in the profession? And if the answer is no, it doesn't make for a fun interview.
Another one, will we accept the MCAT in lieu of the GRE?
We will not be accepting the MCAT in lieu of the GRE. But again, the GRE is not required, so not an issue.
So this one's about financial aid. What is the portion that covers the living cost?
Yeah, let me just, before we go down to more FAQs, I'm just going to give you a brief overview of financial aid. The questions that came up in our last webinar. Roseman will be able to offer federal financial aid immediately for this cohort because we are already a doctoral level approved institution. We can just offer that right away. There's no waiting period. Also, if you're unaware, the only federal financial aid available through Title IV is student loans for anything above a bachelor's degree. So this program will be funded through only federal student loans, the unsubsidized and Graduate Plus loan. Our tuition and fees for the first year is $50,000. However, you are also required to be covered by health insurance on top of that. So our health insurance at Roseman, you will automatically be enrolled in, which is another, about $4,000 for a 13-month period. However, if you have your own health insurance, you can waive out of ours, so you don't need to pay for it. And then, yes, we do offer living expenses that you can take additional Graduate Plus loan and get that refunded to you to help with living expenses. For the first year, that's about $46,000 in living expenses. I always say to our nursing students, like if you're moving to the Vegas area from NorCal or SoCal, generally it's a little cheaper to live in the Vegas area, but those amounts are hard stops for everybody. So whether you drive a Mercedes and want to live in a posh apartment, or whether you live in a house with 5 roommates, everybody gets the same amount. The one exception to that is that if you have children who you need to place in daycare, you can request additional funds to help pay for daycare expenses. We, like any school, don't just trust someone to say, oh yeah, I'm paying daycare. You have to provide proof of that. There are a few other very small exceptions. Also, as far as financial aid, I think those are the main questions. So I think that answered the one you asked, Eric. Dr. Dillon, sorry.
All good. Next question is, can you stay at one clinical site your entire time in school?
Nope, not possible.
Perfect.
So back to the admissions, if they earned a BSN in 2007, well, I don't know, a bachelor's degree in 2007, MS in nursing leadership in 2012, will the GPA and sciences be solely on the MSN coursework, or again, will it be holistic and look at all of them?
We'll be looking at the science courses in which we accept, but we will be reviewing all transcripts accordingly regarding any advanced degrees that you have. So it can potentially come into play, but not necessarily negatively, if you would, because you have a master's of nursing. So that master's degree or advanced degree is a benefit for you. Let's say, for example, if your sciences may be a bit older or the GPA is not quite there, if that makes sense. Oh, thank you for the opportunity. Wait, hold on. I think we talked about this, but it was just how many clinical sites and if any are independently ran by CRNAs.
So that's a great question. At this point, we don't have any CRNA only practices, but we're working on them. What we did was we had to get enough clinical sites so that we could seat students and meet accreditation and graduation requirements. But over the next year or two, we're going to work real hard to get independent sites, hopefully in Henderson and Las Vegas, but there may be other areas of Nevada, because independent practice is very important to myself and Dr. Stelflug.
Will more years in ICU or other critical care areas, such as a flight nurse, be advantageous in making your application more competitive?
So I think the sweet spot is probably 2 to 5 years, maybe 2 to 7 years of ICU experience. I think that's the best. Again, we're going to look at all of the clinical experiences, but again, I would concentrate on having, if you have 1 plus, better 2, better 3 years of hard ICU experience, that's going to be the best applicant. 5 years is great, but once you get out further from that, you're probably farther away from your sciences and from being in school. And this is really a full-time program. This is 3 years of going full blast without a stop. Now, that's not just Roseman's program. That's every program. Every program in the United States, and I've been associated with more than a half dozen of them. It's full-time, it's full blast. Benefit of Roseman's program is you've got largely one class at a time to deal with, which I think is a huge benefit. It's what I did when I was educated in the Army's program. We largely took one class at a time.
So this question is basically regarding interviews. Yes, the application does close on June 1st. We are reviewing applicants and we look to have interviews scheduled sometime this month, and they will continue on up until prior to, or maybe even shortly after the deadline for June 1st. Again, please do not wait to the last minute, because if you do it earlier, that is a benefit for us. It could potentially be a benefit for you if you do things a lot earlier, because you got to remember all of the steps that you need to take to submit an application, which includes your letters of recommendation and things of that nature. So if you struggle to get those, if you apply on June 1st, it may make you ineligible altogether because you don't have everything in order. So if you apply at the deadline, then you're late. That's the way I look at it. And then the class size, we are looking at about 20.
So this piggybacks on what you said. One of our requirements apparently is one letter of recommendation from an educator. Is a unit educator sufficient, or does it need to be like a nursing or a college professor?
I prefer a clinical person, a clinical supervisor. I prefer at least one from education, clinical person. I'm sorry, an education person, and I always prefer a nurse recommendation versus a physician recommendation. So at least one clinical, one from work, one from the school, and nurses versus physicians. But if you've been out of school a while and you can't find somebody who remembers you, then obviously you'll have to ask another person for a recommendation.
So I think we spoke to this, but I'll reiterate this question. But this is the preference on what kind of ICU experience you like to see: SICU, CTICU, or MICU.
They're all good. The
Oh,
issue is it's better if you work in an ICU where you have patients with multi-system failure, where you can speak to multiple pathophysiologic states during an interview. It becomes tougher if you've only worked in a NICU, and it may be tougher if you've worked in a PEDS ICU, maybe not. But even if you're a NICU nurse and you've got good grades and good credentials, we'll consider your application.
This is a great question. How will you ensure your students succeed? What kind of board review prep do you provide and or utilize?
Okay, well, the way we make sure students succeed is providing with them with all of the information they need to practice anesthesia. We will use there's a blueprint that's provided by the organization that does the testing for the national certification exam. But we're also going to use, there's a number of review courses out there. We're going to partner with Apex Anesthesia. I've had good experiences with them for the last 5 or 10 years, and we're going to use the Apex system. And we may choose others as well, but we're going to use Apex as a minimum.
So this one was already answered, but just to reiterate, we will use emotional intelligence in clinical questions as far as the interview process is concerned. Just to reiterate regarding the science GPA, because this question is regarding that and whether or not, if it's not competitive, will that be an automatic disqualification? Keep in mind that the admissions department is going to review your transcripts so that we can see which courses actually satisfy those sciences. Oftentimes what students like to do is create their own science GPA, or they like to, make up their GPA based off of what is on the transcript. But keep in mind, we are only looking at certain things. So sometimes those courses may not be a factor. So I don't want you to overwhelm yourself with trying to do what admissions does. Allow us to do that so that we can let you know. If for some reason we feel like you are not qualified, we will talk to you about that. We will let you know, hey, your GPA is not where it needs to be. Here's some of the recommendations as far as retaking coursework, so forth. But we won't know that answer until we actually have a good idea and a review of your transcripts, because there may be, again, some courses that are not relevant to the sciences that we're looking for. So I don't want you to overwhelm yourselves with that. Allow us to help you with that. And that's going to be by you getting those transcripts over to us for review.
If interviewed, do we need to wait until after the deadline for notification of acceptance into the program?
So what's going to happen is we are going to do interviews. We are not going to wait until after the deadline per se. And the reason being is because we have to get you guys set up for an orientation at the same time. So the orientation typically is going to open up about 30 days prior to the start of class. So start of class is July 8th. So your orientation is going to open up by June 8th. It is only going to be in what I like to consider a rare case that we're going to have what we like to consider last minute offers, because we want to be able to allow you enough time to be able to go through the orientation process as well. So although the cutoff date and application deadline is June 1st, it is only going to be in like a rare instance that we're going to have one of those last minute, if you would, applicants that may come on board. And just know, if you happen to be one of those students, whether you apply prior to the deadline or right up until the deadline, if you happen to be one of those last minute ads, you must be aware that you're going to be up against getting all of that information taken care of as far as interviews and starting the orientation and the program within a very short amount of time. So just want to throw that out there and kind of give you some insight on how that would work.
So one that I can answer while you're looking, Dr. Dillon, is what is the total cost of the program? Because I only mentioned the first year. That is so true. Generally, it's a 3-year program. So our tuition for the 24-25 year is $50,000. However, like any university, it is likely that we would have tuition increases for the next second or third year. We do not run our tuition where if you're admitted in 24-25, you keep that tuition until you graduate. So, and obviously I don't know what the tuition increase would be for the next 2 years. In general, our tuition increases, I've been at Roseman for almost 10 years now, and they hover anywhere between 2 and 5%, depending on all sorts of things. So at a minimum, probably going to be 150-ish thousand, but it's probably going to be something a little more than that. So I'm going to go back to something that Dr. Apatow talked about as well is, obviously we can't guarantee you're going to get a job, but the market for nurse anesthesiologists is really good. So that also, from my perspective, helps with your ability to repay your student loans for that tuition and fees.
So is there a certain point throughout the program that it switches to in-class, or is it mixed online and in-person? Yes, it is a hybrid. Keep in mind that after the first 6 months, you will be required to move to the Henderson, Nevada area. That takes care of that. Do you have a tentative schedule of classes? Typically, I believe typically, if you're offered admissions, we will provide you with a copy of what the schedule of classes look like. And it's mainly an overview. Some things that you want to think about, though, is that it's not going to give you exact dates and times of like your clinical sites and different things like that. We may have it scheduled as far as the time frame. So for example, if there's a 2-week period that you're in a clinical site, that's what the calendar is going to say. It's not going to say where you're going. It's not going to say what time or any of that stuff. That will come later on. And I know a lot of people ask that question because they're trying to plan babysitters, weddings, and different things of that nature. Try not to get married. If your best friend gets married, tell them good luck and you'll send them a gift, because this program is an ultimate sacrifice. So those are some of the things that are gonna happen or not happen for you.
And Dr. Dillon, it's not just this program.
Yeah.
Every single nurse anesthesia program, we've got so much information to give you in what's a really short period of time. We own you for 3 years, and if that's not consistent with the way you see the world, nurse anesthesia is not the right program for you. It's just the way it is. I've taught at 5 or 6 other programs, and it's always the same. If you're earning a doctorate in a hard science like anesthesiology and competing with physicians for the same healthcare dollars, you need to have the same amount of information as they do. In a court of law, I do a lot of expert legal work. In a court of law, the standard of care for a physician anesthesiologist is identical to that of a nurse anesthesiologist. They're the same. So physicians have 4 years of undergraduate, 4 years of medical school, and then 3 years plus of internship and residency. So that's a lot more years than you're going to have to for training. So keep it in mind.
So
So,
I'll go ahead, Sal.
a follow-up to that, how does or will our program promote wellness for students and residents?
Say again, please.
How will our program promote wellness for the students?
We're going to work very hard to do that. What I've decided to do is we're going to hire an operations coordinator who's going to develop a wellness program from day one, so that we can ensure that student wellness is one of our top priorities. And it's important. Eating right, exercise, all of that stuff's important. The fact is, you're going to be working very, very hard.
So this next question is about how many people apply to the program, how many accepted. So we talked about how many would be accepted, but as far as how many people are applying, it changes every day. We get new applicants coming in. Keep in mind, this is a CRNA program. That means it's highly competitive. We get hundreds of applicants and counting. So again, put your name in the hat if you feel like you are a qualified candidate. This is not exclusive to Roseman. This is just the nature of highly competitive programs. So this is also our inaugural cohort, so we don't have any previous year's data of how many applicants and so forth. However, what we can tell you is that because this is a highly competitive program, we are on par with other programs as far as how many applications that we're going to receive and so forth. So again, if you feel like you are qualified, more than likely we require you to submit your paperwork so that we can review you. The other thing about us that might be a little bit different from other institutions is that if you are not qualified, we will provide you with some feedback on some of the things that you can do to kind of maybe increase the overall competitiveness of your application. Again, we're not here to guarantee any of your acceptance, just like we can't guarantee you having jobs. However, we would like to work with you to try to give you some encouragement on how to get yourselves more competitive, if you would.
If you did retake a course, do you choose the higher of the two, or is it a average of the grades?
It's going to be all cumulative. That might be a question I need to get back to you on. Dr. Apatow, we'll probably need to discuss that.
Yeah,
Um,
those are some of the details that we'll
Yeah.
figure out over the next couple weeks.
Yeah. Yes, the application is open and available in Nursing Cast, so you should be able to find it. If you cannot, you can email me at edillon@roseman.edu, and I can send you a direct link for that.
For the CRNA shadowing experience, how do they submit verification? Do they upload it into CAS? Is there a generic form? How does it work?
When someone's asked for an interview, we discuss it. That's how it works. I'm not hunting you down so you can get signatures from somebody. That doesn't make sense.
Yeah.
So
Is level 1 hospital experience more weighted more than level 2 or 3?
not at this time.
Yeah. Okay. You do not need to take the TEAS test. That's not what we're looking for. So it would only be the GRE, which is optional. Yeah, GRE is optional. This is going back to GPA and science GPA minimum. So GPA and science GPA minimum on nursing CAS hard requirements. So again, I guess kind of give you slight insight with this is that all of the colleges and universities that many of you have attended are very different. So we've had some people talk about they went to a pass no pass program. Some of you went to a traditional program where it's grading. So we will be reviewing all transcripts accordingly to only apply credits and grades based off of what we are going to accept. So sometimes your information in CAS may be slightly different because again, if plant biology is not what we're looking for and nursing CAS factors that in, we're taking that out. So there's going to be some manual labor on the admission side of the house that we'll have to do, unfortunately, but that is what we will be doing. So, and that's what we're going to have to do because it would not be fair for you to have courses that are not applicable factored into your science GPA. So that's to kind of give you insight there. Dr. Apatow, is there anything that you look for to make an applicant stand out?
Yeah, applicants that stand out have great grades, great experiences. We can't. It's hard to tell you specifically, but the ideal applicant's going to have A and B grades, and they're going to have worked in the ICU between 2 and 5 years, and they're going to have good recommendations, and their personal statement's going to make sense. It's not going to be a story that's not applicable. So it's good. It's a competitive field. So, but initially, having great grades and or GREs and having good experiences, that's going to be those are the factors that'll make the largest difference.
Yep. All right, so if you have to repeat any of your prerequisites, you will need to have those complete prior to pretty much at the time of application. Keep in mind those prerequisite coursework are going to be factored as a part of your GPA, so we can't wait until matriculation to have those complete. The June application deadline is for the summer start, so it's the June application deadline is for the July start date. Yes, it's a very short window. Very short window.
And that is the only start date we will have annually is
Correct.
one start a year in July.
Yeah.
So, we're working on a tough timeline. The reason we waited this long with regard to applications is we were just accredited, and Roseman University felt strongly that they weren't going to put out any information or any applicant information until we were absolutely accredited. We were accredited officially at the end of January, so now we're moving forward to try to seat the class of 2027 on July 8th of this year.
Correct me if I'm wrong, Dr. Apatow, but working is not an option in this program.
So I've seen this a couple times. So you can, I would leave it up to the individual if they wanted to work for the first 6 months while it's almost all online. So if an individual felt that they could work and do the online coursework during the first 6 months, that's up to them. I'm After that point, I'm not hunting anybody down to see if they're working in an ICU one day a week, but I'm just going on the record to say, if 30 years of experience with this, if after the hard classes start, the science classes start, if you're working, you're not going to succeed. It, I can tell you with assurance, you won't succeed. There's too much information. So I've had students work. I mean, they've ignored my advice, and almost without exception, they wind up failing.
Okay.
So
Yes, we seek letters of recommendation that is embedded in the NurseCast application. Again, the GRE is optional. We talked about the cost of the program. Again, if you have questions surrounding the application, you can email me. Let's see here. So you graduated from here in the US, but wasn't born here. As long as I finish my college degree in the country, I don't need to take English proficiency tests. Yeah, if you have your like your high school and college here, you're not required to take an English proficiency test. Now, Sally, you probably were going to ask this question, but I see it over here. As far as having a BSN from out of the country. So for one, you have to get your foreign transcripts evaluated, and we only accept two organizations. That is Joseph Silney or WES, which is World Education Services. Those are the only two that we accept. So if you have gotten your foreign transcripts reviewed and approved at a different institution under a different company or organization, that does not, it's not applicable for here at Roseman. You have to get those done through Wes or Joseph Silney. So just to put that out there. I live in California and wondering if I could stay at the Riverside or other tentative California clinical sites. That would be a question for you, Dr. Apatow.
no, because during your clinical, there are still going to be some class work and some simulation work. You need to be in town.
Okay.
So I'm going to piggyback off that. And because we get this question in all of our programs, you cannot use federal financial aid to relocate to Nevada. That is on you, whether that's at the beginning or in 6 months. You're not going to get more student loans to help you move here.
Unofficial transcripts accepted initially. So if you have your unofficial transcripts that you could submit to the admissions team, we will review them. But I will tell you, you have to make sure you submit everything to us. And I mean everything, because if I look on one of your transcripts and it says that you have transfer credits from a different institution, and whether you had a bad semester or you feel like it doesn't apply, I'm going to need those transcripts. And what that will do is hold you up. So if you are going to go through all of the work to submit the unofficials or delay your stuff in that, you might as well submit it all into the application. But I do understand if you wanted to submit the unofficials first. And the only thing that we're going to do with that is kind of determine your eligibility to see if you're going to meet the GPA, if you would. But all of the other stuff you will still need as far as the application is concerned to even move you forward with potential interview. So next question, let's see here. We already talked about the science courses and how long they had to be. Um, Graduated from Roseman's program. That doesn't have any, it doesn't have any negative impact on the application. But if you're taking the GRE at the end of March, then, and you want that to be accounted for in your application, then you probably want to wait. Again, it's not required at this point, but if you do take it and you want to submit those scores, then you can, and you want that added, you want to do that all at the same time. Um, let's see if I got more stuff.
I've got about another 10 minutes before I have to jump to a different meeting.
That's totally
But
fine.
Dr. Stelflug might be on if you wanted to make him visible.
Yes, the program is still, Roseman is all on a pass-fail system, just as a FYI. They asked about the cadaver lab, but you kind of went over that, correct?
Yeah, when I I've we've considered a cadaver lab. Having a cadaver lab is just a regulatory nightmare. So there are a couple of different tools, like an arbitrage table, that new technology, and we've got a couple of other technologies we're going to use in lieu of a cadaver lab.
Okay. Is there a minimum number of clinical hours you require before you sit for the board exam? Or is there a
We don't go
clinical
by, we don't
requirement for the
no,
program?
we don't go by in our specialty. We don't we track hours, but they're not as important as clinical cases. You need 650 clinical cases with a certain breakout of subspecialties. That's what we track, and that's what all students will have upon graduation, guaranteed.
Yeah. Um, the letters of recommendation, you have to submit them through nursing cast as an FYI. Here's another question for you, Dr. Apatow. What can you share about the faculty professors who are leading students in this program? Examples include background in the field and teaching and so forth.
All right. Well, I would have to let my colleague, Dr. Stelflug, talk about his precise credentials. I'll tell you, I met Dr. Stelflug when he was in anesthesia program 20 something years ago. Dr. Stelflug has been teaching for years, and he's been a program director at Marion University in Indiana. Myself, I've been teaching, I've been an anesthetist for 30 years, teaching for 20. I have a master's of health science. I have a master's in nursing. I have a doctorate in neuroscience, and I've been the president of the National Board for Certification and Recertification of Nurse Anesthetists. I've started a couple of new programs. I've been involved with a couple of new programs, and I've been program director of several other programs.
Okay. Do we have breaks in between blocks? We're not on the semester, so there you don't have to worry about fall spring. Anytime that the campus is closed, then you will not be in class if you would, but that will vary in between. Again, that will be provided to you during the once you get accepted into the program. We'll have a sample calendar for you, so you'll see what breaks are available.
So one question someone asked is if you have a master's degree, bachelor's, master's, will you run out of loan money? That's actually a really great question because there are something called aggregate loan limits, but that is only on the subsidized and unsubsidized loans. So once you hit the aggregate limits of those, you can actually borrow everything in the Grad Plus loan. The Grad Plus loan is not as good of a loan, but you will have that available.
Dr. Apatow, another question for you. So they understand that there are many clinical sites and that they have to share those sites with other disciplines. Will we achieve enough cases not only to meet required caseloads, but also proficient in skills?
Yeah, I typed the answer to that.
Oh, you did?
Absolutely.
Okay.
It's okay. Absolutely. If you don't become proficient in schools in skills, you can't graduate. You'll be proficient in the full repertoire of anesthesia procedures and patient case types. We can't graduate anyone but the highest level of practitioner. So absolutely.
All right. I know there are a lot of additional questions I'm trying to get through. I'm trying to see which ones may or may not have been answered. But I also want to be respectful of Dr. Apatow's time. Um, so if you do have to leave, you're more than welcome to do so. Not that you need my permission there.
I try to call back in while I'm having this other meet. I don't know if I can,
That's
but
okay. But I'm gonna stay on a little bit longer to try to go through some of these additional questions. Those that I am unable to answer, you guys are more than welcome to email me. I'm going to put my email address in the chat so that you have it. And then what we will do is I can get those questions answered for you and filtered your way.
yeah,
But I
I'll
was
turn those around. If those are anesthesia specific questions, I'll turn those around within a couple of days
mhm,
at the latest.
okay. Let's see here. Because I know we got a lot of repeats in questions, so I'm trying to filter all of those out. Yeah, working full time again, that's going to be a conscious decision you'll have to make, but it's not highly recommended. Um, well, that's not it.
If you
Uh,
work, you're not going to succeed. That's
yeah,
just the way it
yeah.
is.
I know a lot of people are asking about when acceptances are going to go out. Again, it's going to be after the review process and interview. Got to take it one step at a time as to where you're going to be. But again, the other part to this is that the program starts July 8th, right? So although the application deadline is June 1st, we have to be able to give you enough time for orientation. So does that mean we're probably going to send out a few offers prior to June 1st? More than likely, because you have to be prepared for orientation, which will be scheduled to start on June 8th. So, but I'm not
June
guaranteed that
8th?
it's going to be on, May 1st. So don't all start emailing me on May 1st and asking me if the offer is. But
Dr. Dillon, you said
yes,
orientation on June 8th, just so you know.
correct.
June
Yes.
8th?
Well, because we opened the orientation 30 days prior and the program's
Oh,
going to start July 8th.
so it's going to be an online orientation. Okay,
Correct,
my
correct. So we
apologies.
want to make sure that we have enough time for the students to be able to do what they need to do. Give me 1 second because I think I got Dr. Brad here.
Uh, so someone is asking, and this might be a Dr. Dillon question, but I'm starting advanced pharmacology in April. Should I wait until it's finished before applying? I mean,
The
even
answer
I
is
can answer
no,
that. Well,
no.
if your GPA is not good enough, that's not going to be taken into account.
I'm going to have to sign off, ladies and gentlemen. Thanks for your indulgence. I appreciate it.
Thank you, Dr. Aptov.
My pleasure. And I'm always available by email as well.
All right, give me 1 second as I try to get Dr. Stelflug access, if I possibly can. You may need to log out and log back in.
I also need to sign off, Eric.
That's fine.
Dr. Dillon, sorry, my bad.
Yes, thank you.
Thank you, guys. Have a good day, everyone.
Yes. Let me see if I can get him together. I apologize for the difficulty, everyone, but uh, all right, there we go. All right, welcome.
Hello, everybody.
So this is Dr. Stelflug. I always get your name a little messed up on my end, but he is our assistant director for the DNPNA program. So he will be here to answer some additional questions that may be specific to the program that I may not be able to answer. So I'm going to go back to some of the questions. I see there was one about the Likert scale rating. That was specific to your references. So yes, that's what they are supposed to do. So once you send, you input the person's name, they'll get the email, they'll go ahead and do the recommendation. We'll get it on the back end. So that's how that would work. Let's see here. So how many days per week are in-person classes? I'm in Southern Utah. I'm wondering if I could if travel can be an option. So I'll let Dr. Sofa answer it about the days per week, because that can vary, if I'm not mistaken, depending on which block you're in and so forth. What I will say though is living in a different area, I do not recommend you doing the travel back and forth thing, because whether you're flying, driving, or any of that sort of thing, if something happens, you get stuck in traffic, that's not our fault. That's not our problem. You're still expected to be here at a certain time frame. So, you can't come to us and say, well, my flight was delayed due to weather or whatever the case may be. Well, that's your expectation is for you to be here. So we do not take that into consideration, unfortunately.
Yeah, we're going to have some blocks where it's going to be every other day on campus, then a reading day, then on campus. And then some are going to be like clinical, the next day sim, the next day clinical. Driving through Southern Utah, since you live there, during the snow season, the roads are going to be very unpredictable. The desire is going to be driving back home. You're going to have that great pull, and just the amount of time that's going to be spent on the road and not studying is going to be very detrimental to your progress in school. And every student I had in Indiana that tried to do this, that lived in Ohio or Michigan, ended up failing a course. And I'm just being honest with you. It just did not work out. You just have to find a different way to do that with your support system. Highly recommend moving to the Nevada area. The 515, you're going to sit on the 515 forever. There's no easy way to get from the north side of Vegas to Henderson.
Yep.
So you want to be on the south side. So when you're thinking about getting temporary housing, think about being in Henderson, Boulder City, or anywhere on the south side.
Yep. Can you explain the 90 passing again? Do you want to take that, or you want me to take it?
Well, so when you think about passing on any of your exams, most nursing schools had, if it's pass fail, probably 70% was a pass, or you had to get a B to pass, and 70% or 80% was a B. Roseman always has a higher standard for competency, and they, even in their BSN program, it's 90%. They do not take anything lower than that. And if you're a patient, you should expect that. You should expect your healthcare provider to be competent, that only, having at least 90% competency, that should be the minimum you expect your provider to have. So that's where we get the 90%.
Yeah. So, and I'll add to that, so you guys are aware that it's not 90%, or I don't make the 90% and I'm out of the program. That's not how it works. We do participate in what we call remediation. That's a part of the 6-point mastery learning model at the same time. The idea is that we want you to master the content for you to be able to apply the knowledge, not master the content just to pass an exam. So any of you all who are Roseman grads, you already know about that mindset. It's just going to be a different level of thinking for this academic program. But again, I always challenge the students, and I've been saying this for the last 10 plus years that I've worked here. You essentially have someone's life in your hand. And if you know yourself as a patient, that your doctor, your nurse, or medical provider was only 70% proficient versus 90% proficient, you'd want to hit the call button. So think about it in that terms, right? Okay, we're trying to change the face of healthcare so that we can mitigate errors and issues, and that people are more proficient and confident in what they're doing. And that's why our model is the way that it is.
And another point on that 6-point mastery model is assessment as a learning tool. So what that means is there's 2 types of assessment, and not to bore you all with this, but there's formative assessment and summative assessment. You guys are used to a summative assessment. That's your final exam. A formative assessment is not that high stakes exam. It's maybe a quiz, something that doesn't count very much towards your final grade. And so you're going to get formative assessments that don't really count very much. And you're going to be able to review those and find out where your strengths and weaknesses are so that you can build on those and be ready for that summative end of the block summative assessment so that you can master that and show competency at the 90%. That's how we use assessments, those formative assessments, as a learning tool.
So again, any course that you are taking that is a science-based course, if you want it to be factored into your GPA, you may want to wait to apply or not. It just depends, because you got to figure out whatever your grade's going to be. That's the catch-22 there, if you would. Again, there is no entrance exam required, so you don't have to worry about that. Let's see, National High School here. Yeah. All right, looks like everybody answered that question. Let's see if we have anything else. Lots of thank yous. Appreciate it. Thank you guys so much. Let's see. Are there any other final questions? Let me see.
Dorms. We don't have dorms.
No dorms. Yes, that is correct. We have no housing. So you will be responsible for your own housing here. Here in the Nevada area. And like Sally was speaking earlier, if those of you who are coming from out of state, like particularly northern or Southern California, you may find that it is less expensive. We also have no state tax, so that helps. Let's see, want to retake some sciences. Wanted to confirm if straighter line courses are accepted for the sciences. I'm going to let you answer that, Dr. Still.
Straighter line courses.
Yeah, so we actually accept them for the undergraduate program, but I'm not sure if you all are interested in
Not
having.
familiar with straighter line
Yeah,
courses.
so we can talk about that. You can send me an email on that, and then we can follow up with you on how that will work. Will the program have academic advisors? Very good question. So as of right now, you'll have your admissions team that will help you with transitioning into the program. As far as the academic advisors, or I'm assuming more academic support is probably what you're speaking to. Dr. Stufflook, I don't know how we are setting that up for students as they go through the program, because we don't have an actual academic advisor, but I don't know if that's something we are looking to ensure we have for our students on that end.
So Dr. Apatoff and myself will be doing advising, and as we get faculty, we'll add them into the advising. So that way you have a advisor / mentor as you go through the program. Hopefully, as the med school comes online, there will be more funds to get actual academic advising going on. But as traditional academic advising goes, we don't have that. But that role will, actually, I should backtrack a little bit. That role might be consumed into that operationals role that Dr. Apatow talked about.
Yep.
But you will also have the mentor role with us, as we have, like I have 25 years experience as a CRNA. Dr. Apatow has 35 years experience as a CRNA. So we've been there, done that, have the t-shirt multiple times. Yeah, so multiple advisors. The downside with this first class is you don't have student mentors, because you're the first people going through, you're the pioneers. And we'll be asking you to be the mentors for the classes that come behind you. So we will be establishing the student mentorship program. You'll be the pioneers in that too.
And one thing about Roseman too, because we are smaller in size, that also makes it manageable for us to work a little bit closer with the students, especially as your faculty. They have a little bit more engagement with you all. So it's not like what you'll see at a traditional lecture hall of 300 students and everybody's fighting to get an appointment for, you know, the professor, if you would, because there's smaller numbers. They're still going to be, you know, wanting to gain access to your faculty or your faculty advisor, however you want to view that, but it's not as overwhelming, if you would, as you would see in the traditional college setting where there's large lecture halls.
As I've always told all my students, nobody gets through anesthesia school alone. So that's why I love the Roseman model, collaboration. We're going to force you to be in small groups, get you a little uncomfortable, and you're going to thank us when it's all done that you had that. So you're going to have mentors, and you're going to have peers that are going to be your mentors also. These are going to end up being people that you're going to have lifelong friendships with. I still contact people from my small group that I had 28 years ago. Which science courses should I take if I've been out of school longer than 7 years? If you're trying to fit in a science course before on this application, you don't have time. I would bone up on Khan Academy. It's free, it's online. Go through, see what your strengths are, what your weaknesses are, spend some more time on your weaknesses, kind of refocus on chemistry, biochemistry, and physics, because that's basically what we're going to be shooting at you for 3 years. If you're thinking of going for next year's group, look at what your strengths and weaknesses are again. Biochemistry and physics. That's what we're going to be hitting you guys with. Pathophys would be a good one to go with. You may have gotten very comfortable in your ICU role, seeing certain pathology, and good to go back and relook at that.
So we have a question about, so Dr. Apatow mentioned the CCRN certification as a requirement for this program, but that was not mentioned on NurseCast or the school website. Are there other requirements not mentioned to be aware of? No other ones that I am aware of. The references should all be outlined on there. The unencumbered license, certifications, your letters of recommendation, your personal statement, those are all should be outlined on there. And there should be also for the CCRN certification, it might be embedded in the actual NurseCast application as probably one of the list items, but if it is not, we apologize for that. But for those who have that, submit that copy as an uploaded document through the cast, and then we can verify that information a lot quicker.
And I think probably all of you have done this to some degree, but I implore all of you, do your due diligence, investigate the lifestyle of a CRNA. There's plenty of YouTubes of the day of a life of a CRNA. Make sure that this is the life you want. It is a painful 3 years that you're going to go through because, as Dr. Apatow said, and I tell all my former students, we got 3 years to teach you what doctors get 4 years. It's the same content, you're held to the same standards. So it's 3 years of being in Hades. It's a lot. So make sure that this is what you want. Investigate it. You owe it to yourself to make sure this is what you want, because you're going to have to know that what your why is for going through this. And yeah, so do your due diligence, make sure this is what you want, investigate the profession. For me, it's the greatest thing I've ever found, greatest job I've ever had, but make sure that this is the right decision for you.
All right, are there any other final questions that anyone has before we part ways? All right, so, okay, we do have one more from Florida, have a multi-state license. When do we need to apply for a Nevada license if we get admitted?
When you get admitted.
Good
Yeah,
question.
Nevada's not a compact state, probably never will.
Yeah.
But we'll teach you those politics when you get admitted.
So keep in mind, everyone who's still on the call, Portia Braxton is your admissions specialist who will be there to assist you with all of the application and admissions questions that you may have. If she is unavailable, I am also available to assist at the same time. Our goal is to work with you to try to get you prepared for an interview. Once we have figured all of that information out, we are submitting that over to Dr. Apatow and Dr. Stelflug for their review to make their decision. And from that point, we will follow up with you on those next steps on, interview scheduling and so forth. So just bear with us. As you can see, it's a lot of people on this call. So just imagine the amount of people that are on this call is pretty much the amount of people plus that are coming in with inquiries and applications and all that fun stuff. And it's a lot for us to review, so just bear with us, but we are working diligently, and some of you may end up hearing from us relatively soon regarding interviews because we are at that review process. And then the next question I see here, any advice on how to breathe while waiting for the I love that question.
It's the Navy SEAL breathing technique. It's the box breathing technique. You start with like 5 seconds breathing in, hold it for 5 seconds, breathe out for 5 seconds, hold that for 5 seconds, and then you increase each by a second, and you do that and increase for as long as you can. That helps build up your strength and being able to hold your breath, but you don't have to do the increase. If you keep it at the 5 seconds, box breathing, it just relaxes you. You focus on your breathing. That helps just relax the rest of your body. So box breathing is what I recommend. It's also what I do when the stress hits the fan.
There you go. Well, again, thank you all so much for your time. It has been a pleasure answering all of your questions. Hopefully this has cleared the air on a lot of different things. Again, any admissions questions that you may have, please reach out to myself or Portia, and we will work through them and get you all squared away one way or another. So with that being said, you all have a wonderful rest of your weekend, and we look forward to seeing your faces and applications and so forth in the near future. Have a good evening.